Hi everyone, my name is Patrick Liquete, your nursing school tutor, and welcome to part two of the segment on interpreting cardiac rhythms. So on this segment, we're going to be talking, on this part of the segment, we're going to be talking about how to distinguish your normal rhythms as well as your atrial rhythms. Please watch part one if you missed out on how to basically read a regular basic EKG strip, because we're going to be going through those certain findings right there. All right, so when we talk about sinus rhythm, I want you to take that word right there, as we discussed in part one, right? Your sinoatrial node. I want you to take that word sinus and I want you to kind of look at this tiny photo right here. And the first red portion is your sinoatrial node, your SA node, and it leads up to your AV node. So when we say sinus, the electrical conduction is stemming or coming from that SA node. All right, so it's coming from that SA node. So let's take a look at this. So one component I told you guys to find is using the 6-second method, right? We use the 6-second method, and the first thing we do is basically count what we call the R's, right? So we're gonna count the R's. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So but by counting the R's in the 6-second strip, we're going to take that 10 and we're going to multiply it by 10, because there's 10 6 seconds in a minute, right? So we're going to multiply this by 10 and we have 100. So normal regular heart rate is about 60 to 100, so we would find this as normal. And again, from part one, we told you guys that this does not count right here, right? Because you can't see that spike. We're only counting the R spikes. All right, another component we told you to find, is there a P wave? There is a P. Another component we wanted to find is there a QRS? And is there a P to every QRS, right? We're going to take a look at regularity. Does this measure the same as this distance right here from R to R? From R to R. So these are all regular, right? Another thing we're finding is what we call the PR interval. So from the start of the P to the start of the Q, it has to be about 0.12 to 0.2 seconds, or 3 to 5 boxes. And fortunately here we can see about 4 boxes. So everything seems to be laying out completely normal. So that is what we call sinus rhythm, or normal sinus rhythm. Is everything is normal. PR is normal, QRS is normal, the rate, the rhythm, everything is normal. So what do we do about this? Nothing, right? We do nothing about this. This is a regular, healthy electrical conduction. So now let's take a look at your problems. We took a look at the normal, and now we take a look at what we call sinus problems. So the problem is it's still stemming from the sinus, right? But we're gonna have irregularities there, or basically abnormal rates. So one thing we take a look at is what we call sinus tachycardia. The conduction is exactly the same, but one thing that we find is we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 spikes on your 6-second strip. 14 times 10, we have about 140, right? We have about 140 beats per minute. Now, we know that as tachycardia. We still got to look at all your components. We see a P. I know it looks kind of funky because it's so close to the T wave. We see a QRS, and we see a P correlating to every QRS, or there's a P for every QRS. If we look at the regularity between R to R, it is all the same, right? It is all the same, so it's regular. It's just beating very fast. And then lastly, we look at the PR. So that's about 3 boxes. We said 3 to 5 boxes, right? So everything is normal except for the rate. That is what we call tachycardia, And it's sinus, so we have that sinus tachycardia as a term. Now, what do we do about this? What is the cause? So certain causes for this is usually there's usually something that caused this. Nothing cardiac, right? Rarely is this a cardiac problem. The two biggest things I want you to take a look at for nursing school and your NCLEX is going to be is someone's temperature high? They might have an infection, meaning your metabolism's fast and your heart rate's up, Or what is that condition of the person? Are they anxious? Did they just exercise? Did they smoke, right? Are they stressed out, right? Are they exposed to nicotine, caffeine, any stimulants, right? So this is one thing we're taking a look at. There is a cause, and the way to fix this is we basically fix the problem. We find that cause and we fix it, right? Now, so we're going to take a look at bradycardia, sinus bradycardia. If we take the 6-second strip, we take the R's. There's 1, 2, 3, 4 R's. 4 times 10, we have about a rate of 40, right? We have a rate of 40. Now, other components, is there an R to R? The R to R is pretty regular. Is there a P? Is there a Q? Is there a P for every Q? And lastly, of course, we take a look at that PR interval, which is about 4 to 5 boxes here. So that's still pretty normal, right? 3 to 5 boxes is your normal. So the only thing wrong here is the rate, less than, right? It's less than it's less than 60, which puts it at bradycardia, and it's still stemming from the sinus node, so we're still labeling it as sinus. So what is the problem here? Now, we find the cause. Again, we find the cause. We only treat sinus bradycardia if it is symptomatic, right? So what are some causes? What are some normal causes? So your athletes, LeBron James probably has a heart rate of 39. Usain Bolt probably has a heart rate of 30. Your marathon runners, they live off that heart rate because their heart is functioning so effectively. They don't need as many beats, right? They can have the same output from the heart with just one single beat as we would need for 60 to 100 beats. So again, we find out what is causing this, and if it is not symptomatic, we don't treat it. Another common reason in the hospitals that is causing this is usually someone's hypothermic or very, very cold. It slows down your heart rate. Now, what do I mean by symptoms? When you take your NCLEX or you take any test in nursing school, we mean any symptoms. If the blood pressure goes down, if they feel faint, dizzy, if they have a syncopal episode or a fainting episode, if they feel anything at all, they're pale, any of those symptoms, those are symptoms. We have to treat this. So there's 2 ways to treat this. Okay, there's 2 ways to treat this. There's a medication, and then there's electrical conduction way of treating this. Your medication is going to be what we call atropine, right? You've heard that before, right? You've heard it before in your respiratory medications, and one side effect is a high heart rate, and that is why we give it in these situations to increase that heart rate, atropine. Now, for your more unstable patients, atropine's for more stable patients that are symptomatic. If you are unstable, meaning patients in critical condition, maybe about to die, we basically put what we call a pacemaker on the patient. We put an external pacemaker, just like we would do when we're putting pads on the patient, and we set it to the pace setting, and we give it a rate. And we'll basically, that's a discussion for another time on the pacemaker settings, but we give it a rate, we put a pacemaker, and that is what keeps that heart beating. And only when symptomatic is when we're treating it, okay? All right. So we're going to talk about what we call a supraventricular tachycardia or paroxysmal supraventricular tachycardia. The difference is with the word paroxysmal is that it comes and goes, it goes away. But a true SVT or supraventricular tachycardia is basically it's continuing. So what are we looking at here? So the main component you're going to find is that this heart rate is about 150, greater than 150 beats per minute. So we're way past your tachycardia. Now, I want you to take a look here, and I want you to notice that this is not a 6-second strip. This is basically a 3-second strip right here. This is a 3-second strip right here. So instead of multiplying by 10, we're going to multiply this by 20. But let's count your R's. Step 1, count the R's. 1, 2, 3, 4, 5, 6, 7, 8, 9. And if that was a 6-second strip, that would be 18 R's, right? 18 multiply that by 10, this is about 180 beats per minute. So this is 9. If we multiply that by 20 from 3-second strip, that's about 180 beats per minute. Now, some components you're going to find to determine if it's abnormal or not normal from other atrial ventricular rhythms is we got to check out the regularity. So if you look at the other R's, they're going to be regular. They're going to be regular, all right? We can't see the P wave. It's going to be hidden, right? The PR, we can't determine it because we can't see the P wave. But the two things you're going to take a look at is the number one is that rate and the regularity. It is regular. It is regular. And there's most likely a P for every QRS. So we're going to take a look at that, and that is what we call SVT or PSVT, right? SVT or PSVT. Again, what is causing this? Something is causing this. Something is causing this. Any basically disease can cause this, caffeine intake, stimulant intake, right? But we're nearing the point that we can't just randomly fix it by taking away the trigger. We need to do certain maneuvers with this. One such maneuver we give is basically what we call vagal stimulation. Vagal stimulation, okay? So if you know your vagus nerve, right, there's multiple ways to stimulate that. One thing that you can teach your patient is to bear down. What do we mean by that? Is when they're going for that BM or that number 2 feeling, right? The force they exert upon themselves, you're going to teach them to do that. That is one way to do that vagal stimulation. Now, one thing I like to do in the clinical setting for my patients that can't basically follow along or bear down, as an example, is basically I take a nice cotton ball, I put it on the table, I give them a straw, and I tell them to try to blow out that cotton from the cotton off of the table with a straw. That creates that bearing down motion. Now, if all of those components fail, we have an electrical intervention, and that is what we call your cardioversion. Not a defibrillation, but a cardioversion, where the shock sinks to the R's, right? The shock sinks on top of these R's, on each one. That's why we call it, it's a synchronized cardioversion. So that is the treatment when the vagal stimulation doesn't work and your patient is becoming symptomatic. Again, with the symptoms, it's going to be certain things like syncopal episodes, dizziness, faint, weakness, fatigue, blood pressure is low, all those symptoms. Those are what we call symptomatic. All right, so those are most of your sinus rhythms. On the next segment, please follow me for the next segment on part 3 where we discuss atrial rhythms.